Hello, this is Clean Coach Carly. I'm the staff nutritionist at Healthy Habits Living, and I have some questions today about healthcare. Now, in the United States, healthcare is now being called Sickcare because we seem to be going to the doctor much more because we're sick, and less of our medical dollars and time are spent on being well. They're mostly spent on being sick. Why is it that our healthcare insurance premiums are going up and the services are going down? Our copays are going up and our options of doctors or choices are going down. It's interesting to note that over $4.3 trillion are spent each year on healthcare. Now, back in the 1960s, everyone was spending about $10,000 or less on healthcare. Now, fast forward to the 2020s, that number is up to about 20,000. So at the highest range, it has doubled. And 17% of the GPD, that's our gross domestic product, so all the money that's spent in the United States, 17% of it goes to healthcare. And in particular, the highest amount that we're spending is on being hospitalized or going to the hospital. So there's lots of answers and theories to why we are spending so much. Even though we live in an industrial nation, we are one of the richest in the world, but yet we still have the worst or the second worst healthcare in all first world countries. There's lots of ideas and theories, and we could debate that all day long. But what's important to note is that there is a trend of accountability and sovereignty, that people are choosing to put their time, their money, and their priorities where their health is, whether that's with a doctor or without a doctor. And this is evidenced by the availability of all sorts of testing online. You can get your genetics tested online. You can get your nose cultured online. You can test for food allergies or sensitivities. You can even order your own continuous blood glucose monitors now, which used to only be available by prescription. All of these are ways that you can take your health into your own hands. Not that you won't employ or ask for a doctor's help, but that you will be educated and proactive. Now, for any disease state or health state, prevention is always the easiest cure. And so developing an attitude of self-care and the responsibility and the accountability for your own health is a somewhat novel idea, but seems to be taking off in the United States. So here are a couple of ideas about developing this mindset and what you can do practically and physically to add to your prevention and taking your own health future into your hands. So the basics are: understand inflammation. All diseases and symptoms have an aspect of inflammation. In fact, some people believe that all diseases start or cause inflammation. So inflammation, if you understand that process in your body, is one of the keys to taking control of your own health in the long term. Now, our bodies are meant to create inflammation, but they're also meant to be anti-inflammatory as well. We're supposed to take in anti-inflammatory nutrients and do things that lower our stress hormone in particular, so that we don't have as much oxidation. So that would mean we wouldn't need as much antioxidation. So the basics of living an anti-inflammatory lifestyle so that you can prevent or manage symptoms that you have is living an anti-inflammatory lifestyle. So that starts with diet. Eating an anti-inflammatory diet. Now, that is a very broad term that encompasses a lot of different diets. But one thing that is popular when someone wants to follow an anti-inflammatory diet is to do an elimination diet. Something like Whole30, where you take out all inflammatory foods for 30 days and see how that affects your energy, your cognition, your joints, your skin, and your sleeping. And then introducing those foods back in one at a time to see if one or more of them is causing your body ongoing inflammation. So the basics for an anti-inflammatory lifestyle are an anti-inflammatory diet. So that also means eating whole foods, eating foods that don't have preservatives. So instead of eating potato chips, you eat a baked potato because it has less processing, less preservatives, less additives, less chemicals, which means less inflammation. The other part of an anti-inflammatory lifestyle that is important is drinking water, as opposed to drinking soda or juice or whatever else might be laden with sugar and caffeine. And drinking clean water that is filtered, not just tap water, which may have up to 300 contaminants in it. Another key part to an anti-inflammatory lifestyle is not eating sugar. Now, of course, sugar falls under processed foods, but sugar is also very addictive and causes a lot of oxidative stress because it raises blood sugar, and then you get low blood sugar, which causes oxidative stress, which leads to inflammation. So staying off the blood sugar roller coaster is very important to an anti-inflammatory diet and lifestyle. The next thing to think about with the basics of an anti-inflammatory lifestyle is the air that you breathe. Now, whether you're outside or inside, think about what is in your air. Some of us live in areas where there's lots of air pollution or there's lots of air allergens. So it's important to know your air quality and to use air filters if you have a concern. We breathe all day long. We have to have air to survive. So we need to have a clean source of air that is not causing us inflammation, but actually helping us to reduce inflammation. And the last strategy for an anti-inflammatory diet and lifestyle would be getting enough sleep. Now, how is that anti-inflammatory? Well, if we're running around with not enough sleep, we have very high stress hormones, adrenaline and cortisol. And when we are running with high amounts of those in the system, we are causing oxidative stress all day long, every day. And oxidative stress shows up in mitochondrial damage, which we can't really see, but we feel. It also shows up in fine lines and wrinkles, which we can see. So having a sleep ritual, a sleep schedule is very important to an anti-inflammatory lifestyle. And another thing that you can do to be proactive or preventive, instead of running to the doctor every time you have a symptom, is to know your body and to have healthy home pharmacy remedies at home, things that you know are helpful and that work. For example, I always keep emu weight on hand because I know that it helps with skin conditions and eases the pain of a cut or bruise or even a minor something that I think that, I don't know if I'm going to need to go to the doctor. Maybe that could get infected. It keeps that from getting infected and helps the skin to heal in a clean and safe manner, as opposed to having to go to the doctor and get it dressed or getting antibiotics or I'm worried that it's going to get infected. Another thing that I always keep on hand is elderberry syrup because it has been absolutely proven to shorten the duration of a cold or flu so that it doesn't turn into a sinus problem or sinus infection. So taking preventive actions or interceding on your own behalf before things get more escalated is a practice that helps in antioxidant or anti-inflammatory lifestyle, but also helps you stay out of the hospital and in the emergency room in the long run. So being proactive, taking accountability, and taking your own medical sovereignty is the overall theme. And living an anti-inflammatory and a healthy lifestyle is the most important action point on being responsible for your own health. So I may not have all the answers to our healthcare, but the attitude of taking care of yourself will go a long ways in prevention and also symptom management. Here at Healthy Habits Living, we're always here to support you so that you can get healthy and stay healthy so that you can be healthy.